Good afternoon, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Coastal Bend COVID-19 Pandemic Task Force. And I'm here to give you the weekly report for April 16th, 2021. Having a little bit of technical difficulties where I can't show my webcam for some reason right now, so we're just going to move forward without it this week. Okay, the task force has two objectives. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. There are several interventions that are taking place right now to control the spread of COVID-19. Number one is you're strongly encouraged to get vaccinated. The quickest way to the end of this pandemic and the quickest way back to normal is for somewhere between 70 and 80%, maybe some people are saying even 90% of the population to be immune to COVID, and that can only happen two ways. One is you get COVID and you recover, and the other is that you get vaccinated and then don't have to go through the unpleasantness of having gotten COVID. Right now, the risk of contracting COVID in the community or encountering it is high. This is from the noasisknows.com risk dashboard. This is the second to highest level, so there's orange and then there's red. So there's still a high risk of contracting COVID, and it's certainly not the time to start taking your masks off. You're encouraged to avoid crowds, continue to wear those face coverings and social distance, because even if you've been vaccinated, there are breakthrough cases where people are getting COVID even if they have been vaccinated. And while we're not expecting that everybody's going to wear their masks forever, while the risk of encountering COVID is high, you should really wear your mask to help to avoid a circumstance where, say, we get a new variant where it's immune to the vaccine itself. And the way that that's going to happen is if we let a large number of people that have been vaccinated come in contact with COVID. So for these reasons, we're encouraging that you continue to wear your face coverings, whether you've been vaccinated or not. When the level of COVID in the community decreases to a low level, then we can take off our masks, and preferably that'll also occur when a high proportion of people have been vaccinated. If you do start to feel sick, you should isolate yourself, contact your healthcare professional. Also isolate if you've been exposed to somebody else who tested positive. This helps to stop the chain. You got to break that COVID chain and stop it from getting passed on. We're impartial to all remote schooling, depending upon what school you attend. And those are the interventions that are taking place. There have been 42,494 confirmed cases in the Coastal Bend since March of 2020. Of those, there have been 40,623 confirmed recoveries. Remember that these numbers, they don't include everybody who's gotten COVID. They only include the people who are classified as a confirmed case by the state. So a confirmed case is somebody who got that nose swab test, or somebody who got one of the other COVID tests combined with a physician's diagnosis. Those are confirmed cases, but there's plenty of people that don't get confirmed. We're estimating right now that up to 39%, maybe 40% of the Coastal Bend has recovered from COVID. And presently there are 624 active confirmed cases, and that's down 1.6% from last week. The transmission rate is an estimate of how many more people get infected from the current batch of infected people. So if you see a transmission rate of what we have today, 0.98, what that means is that if 100 people right now have COVID, then next week they'll transmit that to 98 people. So that would be 2 fewer people than this week, which is a slight decline. Now there is error in our estimate, so you should see this as being essentially 1, and the transmission rate might be slightly above or slightly below 1. You can see the graph of the transmission rate here. You can see 1 is this dashed line there, and the reason why 1 is so important is because above 1, like happened during spring break, COVID starts spreading, and if we get below 1, then COVID starts receding. The fact that we're right about 1 right now, what that means is that as people are getting vaccinated and presumably becoming immune, there's a disproportionate amount of people that are letting up their guard and becoming infected. That's what would keep us at this one level. If we kept up the same amount of vigilance and people were getting vaccinated, this transmission rate would drop much lower. You can see that not very long ago in February, we were down at about 0.6 on that transmission rate. So only 60 people next week having COVID if 100 people had it this week. So you're encouraged to stay vigilant right now. This will help us get through the pandemic at the end. I know the light's at the end of the tunnel. I'm right there with you. Just as a reminder, we calibrate this model against the number of weekly new cases. Each point on here is the number of weekly confirmed cases. I didn't put any axes on here because that's not the important part of this figure. The important part is how well does the orange data, which is simulated from the model, match the actual black data. And we're not going for a perfect fit. We're trying to fit this smooth curve through there. You can see that we've got a decent fit, and that's where right now we're at this transmission rate of 0.98. Based on that, we can make a projection of how many daily confirmed cases we'll be seeing in the future. And for the next month, we're looking at least right now, about the same number of new cases as we've been seeing. It can vary above and below the average that we're at now, maybe up to 100 confirmed cases, or down to a very small number. You know, sometimes I think we've seen 10 or so in the last month confirmed cases on a particular day. So that was all for the coastal bend. We're breaking it now down by county, and you can see county by county there's fairly different patterns. Last week in Nueces we were going down. This week we're going up. In San Patricio they only announce once every week, so they had an announcement here. They had an announcement here last week, and the next one will be today, so we don't see a new value there yet. Jim Wells is increasing, Aransas is increasing, Claiborne is declining. Overall, there's mixed trends here, which leads us to have that overall transmission rate of about 1. If we zoom out to the South Texas metro areas, you can see that there's a pattern where most or the majority of these metro areas are starting to turn upwards a little bit. At the very least, they're leveling off. The only one that's not leveling off is McAllen, which is still headed downwards. So that's a good sign. So there are mixed trends here, but if you look for the majority trend, it's a leveling off to a slight increase in COVID. If you look at the whole state, you see a very similar pattern as for the metro areas of South Texas. These are the Texas public health regions. And right now we're seeing a resurgence of COVID in Amarillo, which is up here in this part of Texas, as well as in El Paso and that area. In South Texas, overall, it does look like there's a downwards trend. Overall, either leveling off, slightly downwards, or a couple areas of Texas are starting to increase. Looking at the hospitalizations, these are the number of people in the hospital with COVID each day. That's the census number of COVID patients. That's what each of these points represents. And over the past week, there's been a slight decline, but it's remained fairly similar. Underneath here, we have the projection overlaid on the actual census, and the projection is slightly lower. And the reason why this is happening is that there's a higher proportion of people getting hospitalized per person getting confirmed with COVID, or per confirmed case of COVID. And so there could be a variety of things that contribute to that. One would be that the hospitals, feeling less strain, might be admitting people with milder symptoms. A second one is that there are new, more transmissive variants that cause more severe illness in younger people, like B117. That can be causing part of this increasing trend that we see here. Not increasing trend, but we're under projecting, which means that a higher proportion of people are being hospitalized per the proportion of people that are testing positive for COVID than we've seen kind of back in the past from November through the end of January. So that's what this area represents, an increased number of inpatients per confirmed COVID case. We'll be tracking this, but in the projection, we're projecting for a slight decrease through time, but mostly level. And so we expect this number to stay pretty similar to where it's at now. So we'll have to keep watching this. Moving on to ICU patients, the red represents the number of people in the ICU with COVID, which on April 14th was 16. The number of ICU patients without COVID was 159 for a total of 175 ICU patients on April 14th. The 159 is important because if you look over here, this blue line represents the average number of ICU patients in the Coastal Bend prior to the big COVID surge that we experienced last summer. So you can see this as being the benchmark at which if we're servicing approximately that many people without COVID, then there's not a decline in the level of care that people are receiving. So somebody that needs ICU care can get it right now the same way that they could before the pandemic really hit the Coastal Bend hard. This is the same plot as the last plot, so actually right here is the same plot as the last plot, but for the whole state of Texas, each one of these is a trauma service area. If you're interested in the proportion of patients that are COVID positive or not COVID positive in the ICUs in the state of Texas, you can pause the video and take a look at this slide. We'll move forward. This slide, I think, gives you a good intuitive way of determining how much impact is COVID having on our ICUs. And the more red you see, the more impact that there is. So right now you're seeing a lot of blue across the state, but we are seeing a little bit more red in this Midland, Odessa area and in the College Station area than we have in the past couple weeks. So that indicates a slight increase in the strain on the ICUs there due to COVID. In terms of fatality rates, we measure this in two different ways. One is the weekly fatality rate, where each one of these points represents the number of recorded fatalities for the past 7 days. You can see that the data is pretty consistent. It's been declining, and you can see our projection here fits the data quite well. It did drop down pretty low, but is now bumping back up towards the projection. This next slide is the same data, except it's daily instead of weekly. So each data point represents the number of fatalities from COVID recorded per day. You can see it's more noisy, which is why we look at both of these to determine how good the fit is. The important part is that the projection is for the level of daily fatalities to remain approximately similar to what we're seeing now. So it's not going down to zero, unfortunately. But it is a lot lower than we have been in the past. So we'll keep watching this. Hopefully, if we all stay vigilant, we can pull this number down a lot lower than it is now. We should be able to get this down to zero. It'd be nice to see this projection right on that zero line. Okay, looking at the total number of confirmed fatalities from COVID in the Coastal Bend, we're at 1,247. And there have been 761 fatalities in Nueces. I want to remind everybody that this data comes from the state. They process the death certificates. If COVID is the primary cause of death, then that death certificate gets added to this count. Necessarily, it takes some time for those death certificates to get processed, which contributes to the leveling off pattern here, but we've actually had a leveling off in the rate of fatalities overall, so it's not increasing nearly as much as it has in the past. Moving on to vaccinations. In the Coastal Bend, we're right around 25% of the population having been fully vaccinated, which is right around where Nueces is here, but it can be as low as 18% and as high as about 34%, 35% in Kennedy, and most of the other counties are somewhere in between, either Live Oak or Kennedy. When we look at the whole state, this is each trauma service area in the state. We're right here in the Coastal Bend at 25% of the population being fully vaccinated. And we're right now in somewhere around third or fourth place in the state in terms of proportion of the population that's been vaccinated, with the lower Rio Grande Valley and the Laredo area and the El Paso area also having a large proportion, or a larger proportion of their population having been vaccinated. Now we have a little bit more data for you this week. First, let's look at this plot of people with at least one vaccine dose through time. So now we're looking at trends. Last week, this was a fairly solid S-curve, and I was concerned that the demand for vaccines was dwindling. But what happened in the last week is the public health department started opening up venues simultaneously, including at the mall, at Robstown, at the ABC Center, and we're thinking that this probably contributed in large part to this really large jump in the number of people with at least one vaccine dose from last week. If you look through this graph, you won't find a week that we went through where there was a bigger jump from one week to the next. So that was a good break in that pattern, and we can go back to estimating that there's been an approximately linear increase in the number of people vaccinated in the Coastal Bend with at least one dose or two doses. We're also breaking this down this week by age category. So the state has this data available where we can look at people between the ages of 0 and 15, where nobody's been vaccinated, right? Because none of the vaccines have been approved yet for people under 16. But also we can see that the 65 to 79-year-old age group has the largest proportion of people that have been vaccinated. Again, this data is for the whole Coastal Bend, all of the counties in the Coastal Bend. And so the second most vaccinated age group are the 80 plus. And then from there we have the 50 to 64-year-olds. And then down here at about, 26% or so, or maybe even 27, 28% are the people between 16 and 49. I want to let you know that we on the task force don't determine these age categories. Obviously, you want more breakdown at the higher ages, because that's where COVID is more deadly or causes more negative side effects. But this is the way the state has broken up the data, so this is the way that we have to work with it, unless we want to combine any of these age groups together. So you can see this last week's increase in all the age groups pretty much across the board. We've seen a fairly steep increase in the percentage of each of these age groups' vaccination rate. So in summary, the new cases are level to slightly increasing. It depends on where you look. In Nueces, the cases are increasing. Across the Coastal Bend, they're approximately level. This same sort of mixed pattern spread, you can see it across the whole state, not just in the Coastal Bend. Hospitalizations and fatalities are approximately level to declining slightly. We hope that they continue to decline. And I think we want to remind everybody that based upon the proportion of people in the Coastal Bend that have have COVID and have recovered, which is at the highest end of our estimate is 40%, combined with the 25% that are fully vaccinated, that works out to 55% of the population being more or less immune to COVID. I want to remind you that we need to get to somewhere between 70 and 90% of the population being immune to COVID to have to achieve herd immunity. Where we're at now, there's still the possibility to have another major outbreak. And I don't know if I mentioned it earlier, but we can look at the rates of people that have been vaccinated and the population size of the Coastal Bend, and we can estimate that the probability of dying from COVID if you contract it has decreased by about 50% due to the vaccinations. Now that doesn't mean that if you haven't been vaccinated that your probability of having a negative outcome has declined. It just means that over the whole community, if we look at the community as a whole and we look at a random person contracting COVID, the fatality rate would now be lower than it was in the past due to the vaccinations. So You're encouraged to stay vigilant, get vaccinated if you can. These vaccinations, they're working, they're getting us there, but we're not there yet. You're strongly encouraged to wear your face coverings. If you have a cotton mask and a surgical mask, double up, even if you've been vaccinated. And here's why. Right now, there's still a lot of COVID in the community. There's a lot of COVID in the United States. We're seeing new outbreaks starting in the northern Midwest. And it's possible that if you're vaccinated and you get exposed to enough coronavirus, that you'll find the virus variant that's immune to the vaccine itself. And we don't want that to happen. So by wearing a face covering, what you're doing is you're protecting yourself, but more by all of us doing it, we're protecting our community as a whole from having to go through the experience of maybe a reset. If a new variant arises that's completely immune to the vaccines, that pretty much sets us back a year ago. And we really don't want that to happen. So if you think about it, the minor inconvenience of wearing a mask versus the possibility, however slight it might be right now, but that possibility is there and real, that a new variant arises that is not affected by the vaccines. To me, it's an easy decision to keep wearing that mask when you go out in public. Obviously, multi-household celebrations would be discouraged for exactly this reason. So I hope that I've done a good job of explaining that, and the reason why you want to keep wearing a mask is because we don't want to promote the development of a variant that will change the game of this pandemic and put us into extra innings. Let's have the game end when it's supposed to end instead of in overtime. Okay, so that's our report for this week. As always, we welcome your comments, suggestions, and questions on our social media sites on Facebook, Twitter, and Instagram. Our handle's at CBCovid. It's easy to find. We answer your questions each week live at noon on Fridays. It's myself, the Public Health Director, Annette Rodriguez for Nueces County, and then two task force members, Tiffany Anderson and Jason Lewis, and we address those questions live, and we also take questions live on the air as well as addressing all the social media feedback that we get over the week. So I want to thank you for tuning in. I hope everybody has a safe and pleasant weekend, and we'll see you next week.